Think, talk, laugh. Piensa, habla, ríete.
But we have a special guest today, my own concierge doctor.
Yeah, and he told me, Lynn, that you will likely outlive him before we came on air. I was quite impressed with that.
Is this something I ought to know?
And Dr. Bruce
Corser.
Corser?
Dr. Bruce Corser, my
is.
personal physician.
Concierge medicine, I can barely say. Is that a French word?
Yes,
if it's
it is.
We need to find a way to change that. Personalized medicine. Can we change that to something, Dave, that's not French?
Now, what is concierge medicine? It's a relationship between the patient and the primary care physician in which the patient pays a yearly membership fee. So we also call it a membership practice. So this allows the primary care doctor to limit his total number of patients. Thereby, he's able to spend more time with the patients. I give my patients my cell phone. I see my patients when they go into the hospital. And this is different than the standard primary care arrangement. Primary care doctors are so stretched, they often see 3,000 to 5,000 patients yearly, and it's very difficult for these primary care guys to really take care of their patients. Concierge practice allows us to focus on disease management. If somebody's got a particularly severe illness, we can concentrate on that illness and assure that they will have the optimal health care. What has happened over the last decade is that most primary care doctors don't go to the hospital anymore, simply because they don't have time. So when you go into a hospital, as a patient admitted to the hospital, they see a hospitalist while they're in the hospital, and then the hospitalist discharges them back to the care of their primary care doctor. A concierge doctor, at least I anyway, will actually see the patient while they're in their hospital and then follow them up as an outpatient as well.
How do you know when to limit the amount of patients that you can take on as a concierge physician?
Well, many concierge docs set an upper limit. For example, there's a group called MDVIP, which limits the total number of patients to 600.
Per doctor?
Per doctor.
Right,
So
right.
I think generally what I've heard, and this varies in different parts of the country, but probably anywhere between 100 and 600 patients is the usual limit. There's a membership fee for the concierge practice, which is paid yearly.
How much is that?
Well, in the Cincinnati market, it's generally around $1,500 per person
Wow, that
per
was
year.
way over.
So yeah, that's
It's a ThinkTalkLaf discount, Terry, that you're giving.
the two broad groups of people that may benefit from concierge medicine. Number one are people that just can't afford to wait to see a doctor. They can't afford to go in and wait 45 minutes to see their primary care physician. Second group is those people with various disease states that need more intensive care than they could get in a standard physician's office. So as a broad overview, I think those are the two types of people that might benefit from that type of practice.
Well, we have two callers on the line. First one is Alice from Glendale.
Alice, welcome to ThinkTalkLaf.
Thank you very much. I'm glad to be here. I would like to say this is a testimonial for the concierge doctors. I'm 85 years old. I have been a patient of Dr. Corser's long before he became a concierge doctor, and I've been with him ever since that time. I can't speak more highly of the system itself, particularly as you get older and your needs get better and stronger, or not better, worse. I also think it's a wonderful system to have the feeling of knowing that somebody's there who answers the phone when you call and arrange all the situations you might face. If you have to go to some other doctor for some other specialist, that all works out. Dr. Corser is what my husband used to call him, the quarterback.
Well, Alice, I only have one question for you. Did you get a discount on your monthly retainer for making this call for Dr. Corser?
Well, I'm gonna try. I'll do the best. That's all
Alice,
I can do, but he's wonderful, and it's a great program. I'm all for it.
Well, we appreciate your call, and congrats to you, Dr. Corser, for that call. The final point that we talked about very quickly, the make the house calls, that's two ways. You will make house calls, Dr. Corser, but I think this article from Lisa Gershner that we followed here, the 6 things you need to know about concierge medicine, encourages them to make a house call to you to check out what the doctor is willing to do, what the wait times are, etc. Very quickly, can you comment on that?
Absolutely. Yeah. Get to know your doctor. If you want a concierge service, talk to the concierge doctor before you make that arrangement.
Well, Dr. Corser, we are so glad you came in. Lynn, thanks for letting him off the hook a little while of your medicine case to come in and share with us.
I'm going to see him immediately after the show.
Are you? Is part of the plan? Did you know that, Dr. Corser?
This is news to me.
Well, it makes the house call more efficient.
Exactly. Well, this
it's a
house
radio
call.
call.
No one come to the studio because Dr. Corser's here. He's not seeing patients, at least here. We are so glad you joined us here today for Think Talk Laugh. Please do come back.